I'm really excited to introduce Bethany to you today. Bethany began her nursing career in the cardiac progressive care unit, then transitioned to the cardiac ICU. She then returned to school to earn her family nurse practitioner degree, and she currently works in Jacksonville, Florida as a cardiac NP, specializing in structural heart disease. She coaches health alongside her husband, Adam, and they focus on their passion, and their biggest passion is their hanging out with their son. Bethany, you just recently published an article in Advance for Nurses on how health coaching is an extension of your nursing. So would you be willing to share with us how you see that?
Absolutely. Just listening to the presentation starting this webinar, it makes me just get fired up all over again as to why I was looking for something like this. A lot of people come to this world looking to improve their physical health. For me, I felt blessed that I had pretty much figured that part out. I know how to eat healthy and exercise and sleep and, maintain a healthy weight. But being a bedside nurse, I definitely felt that disconnect that you were talking about, Donnie, in the beginning, where I had expectations and ways I thought I was going to help people, and I turned out just very disheartened. And I thought, well, if I can just get away from the bedside, if I can get away from the bedside, I'm going to find exactly what I'm looking for too. And that's kind of why I went to family nurse practitioner school. I thought I'd become more preventative and be able to help people before they reached that awful stage where they were really sick in the hospital and so far beyond where they needed to be. So, I went back to school and went to nurse practitioner school and still was working with cardiac patients. And as you guys saw, that's the #1 killer in America. So my job is quite busy, full of taking care of a lot of sick people. And, I really found this looking for more of the mental, spiritual health. For me, it was, I have to find a way to share health with others that I'm seeing affected by disease every day. I've got to find a way to be involved in my own spiritual growth that way. And also, you talk about the healthcare system and how, the spending is not really sustainable and the way that we're going is not really sustainable. And I want to be a part of the solution. I want to be a part of, like you guys mentioned, the extraordinary measures of doing something just a little different. And that's been fearful for me. That's been scary for me. But that's the beauty of working with a great team like Donnie. You have support along the way to guide you and teach you. So